First of all, I would like to hear about the hotspots. Could you, or are you looking into giving more than 25% of the vaccines to hotspots and allocate more like the science table is asking?
Well, yes, as you know, the science table advised that we really attend to the hotspots as a way of getting transmission down across the entire province. So we did follow their recommendation with the 25% off the top. They are now recommending 50%, and we're looking at that now because we know that does have a really significant effect in reducing transmission, getting the numbers down, which means fewer people hospitalized and so on.
So a new recommendation could come up a decision could come up anytime now? Or?
I expect very soon, yes. We're studying it very carefully right now.
Okay, and have you heard back from Minister Furry about the help coming from Newfoundland?
Yes.
Do you have numbers you can share? Or?
Yes, actually, I believe there's a team of 9 people that will be arriving tomorrow. So we're very grateful for the help that we're receiving from Newfoundland. There are other provinces that are offering PPE, and we're looking at maybe receiving some more people from some other provinces too. But we know that there are some provinces that are really struggling as well with COVID, so they need their own people. But we're grateful very much so for the help that we're receiving.
The 9 healthcare workers we're going to receive?
They're experienced in intensive care, and one is Premier Fury's wife, who is a critical care doctor herself. So these are people who are very knowledgeable, who will be able to put into the top levels to really help out.
We're now going to move to the phone line for a question.
Okay.
Your first question comes from Ian Sheriff Scott with iPolitics.
Hi.
Hi, Minister. Good afternoon. So during question period, the science table again tweeted its recommendation to target the hotspots with 50% of the vaccines, and of course they say this can prevent 20% of infections. So, what is the possible justification for not doing this right away and with some urgency? Why are you saying that your government is kind of assessing this and not jumping on it?
Well, this is something that just came forward quite recently by the Science Advisory Table. So we know that if we can deal with the hotspots in this way, that it's 20% of the areas in Ontario that are causing 80% of the infections. So we take this recommendation very seriously and expect to have a final decision made very shortly on it.
Ian, do you have a follow-up?
Yeah, thanks. So the federal government has delivered more than 11 million rapid tests to Ontario, but the province has used just a little over 1.3 million. So can you tell me why that's the case, and does Ontario have plans to increase their use?
Yes, actually, we've allocated over 6.4 million of the rapid tests to businesses across the province of Ontario. They're with them now to start using them, and we're actually looking for more uses to which we can put them, because they're going to be very helpful in terms of discerning if anybody has a case of COVID if they're going into a workplace, or we may be using them for schools in the going forward, or for where large groups of people are getting together. So we're very grateful for the allocation of vaccines from the federal government, and we have allocated a significant number of them.
Your next question is from Laura Stone with the Globe and Mail.
Hi, Laura.
Hi, Minister. Can you clarify, so are you considering following the science table recommendations about limiting the number of hotspots and sending 50% of vaccines to those? And are you going to do something that's targeted more towards what's happening in Peel and specifically Brampton right now?
We're actually looking at all of the hotspots, and of course there are many in Peel that will benefit from the 25% allocation, and if we go to the 50% allocation, that even more so. It's really important that we've been limited up until now on the supply of vaccines that we're receiving, but starting next week, we will be receiving much higher levels of doses from Pfizer. And so we don't want to be able to take vaccines away from any groups right now if we were to go to the 50%. But starting next week, should we decide to move forward with that, we would have a much larger allocation of vaccines to be able to put into those hotspot areas. And we're also taking a look, because we are not entirely sure about when our AstraZeneca vaccines are going to be coming in next. And the Moderna vaccines have been delayed 3 times times, and now we're receiving about half of the level of doses we expected to receive. We're now doing a pilot project with several pharmacies in putting Pfizer into those pharmacies and making sure that we can do that safely, because you're, I'm sure, very aware of the cold storage requirements of the Pfizer vaccines and what they call the jiggle factor, that you're not supposed to move them very much. And we also need to make sure that all of the pharmacists who are going to be doing the vaccinations are knowledgeable as far as the allocation of the Pfizer vaccines are concerned too. So this is also something that we're looking to roll out quickly, because we want to make sure that we can continue to have as many places open for vaccinations as possible.
Can you address the criticism that your government has not done enough for Brampton specifically, and and if the horrific situation we saw yesterday with the death of Emily Villegas? I mean, what do you want to say to that family, and can you tell the public how you're going to try to do more for that part of Peel?
Well, of course, my condolences go out to the family. This is a tragedy, the death of such a young person. And I mean, every death from COVID is a tragedy, but for someone so young, I'm sure it's devastating to her family. It's devastating to all of us to hear about it, and all of our condolences and thoughts go out to them. As far as Peel is concerned, in Brampton specifically, they have 25 hotspots in their area. That is why we are allocating extra vaccines. We are making sure that we, as far as hospital allocations and so on and availability is concerned, that's why we had to ramp down the surgeries and procedures across hospitals in Ontario to create another 700 to 1,000 more spaces. That's why we're also acting as one team in Ontario and making sure that we can transfer patients from one hospital to another to avoid any particular hospitals, including in the hotspots, from becoming overwhelmed. So we are taking these steps so that if anyone in Brampton or Peel needs to be in hospital and needs to be in intensive care, that we will have a space for them.
Last question.
Antonella Artuso, Toronto Sun.
Hi, Antonella.
Hi, Minister. Last week, Dr. Heyer mentioned that there were community deaths from COVID, and we just learned that the coroner's office is investigating a number of deaths. Can you shed any more light on why this is happening?
I'm sorry, could you be a bit more specific? More deaths in the community?
People dying, never having made it to hospital, dying in their homes.
Well, I will look to Dr. Heyer to, I know that as Chief Coroner, he has a responsibility for that. We want to make sure that more people become aware of the signs of COVID and that they do go to hospital if they're experiencing significant symptoms, shortness of breath especially, because we want to make sure that everyone who needs to be in hospital, first of all, will have a place, but that people will know that that is the case, and that they know the symptoms of COVID and need to get to hospital as soon as possible if they are showing those significant symptoms. But Dr. Heyer's review and report, of course, is going to be very helpful to us to understand if there are any other concerns that we need to be aware of.
Thank you. This also follows up on Laura's question. Do you think people are concerned about going to hospital, even if they have symptoms of COVID, that the bad news coming out about overcrowding and the number of COVID cases and concerns over ICU beds might be keeping people away from seeking help when maybe they should be?
Well, people, there may be some people that are worried about it, but they don't need to be. We have space in our hospitals. That's why we're taking all of the steps that we're taking now, reducing the non-emergent surgeries and procedures, being able to redeploy staff so that we'll have the spaces, making sure that we can transfer patients from one place to another to ensure that they receive excellent care. And now we've asked for assistance from other provinces and territories and and with the federal government to make sure that we can operate other facilities that we're opening, such as the mobile hospitals, both at Sunnybrook and in Hamilton. So we are creating the spaces. We do have qualified healthcare resources available. And so if people do have symptoms of COVID or want to be tested, please, first of all, go make sure if you're feeling well enough to be tested, go to a testing center. But if you have any serious issues, such as shortness of breath, please go to the hospital. You will receive care there.
Thanks, everyone.
Thank you. Thank you very much.